the State of Health. I'm your host, Karen Bowling, Cabinet Secretary for the West Virginia Department of Health and Human Resources. We are cooking up something different for you on today's show. We're on location at Darren Fisher Design Kitchens in Charleston, where they've graciously allowed us to use their kitchen. We're going to show you how you can stay healthy during the winter months, from the meals you prepare to exercise. DHHR partners with many organizations to help West Virginians lead a healthier life. I first want to welcome Jessica Wright, Director of the Division of Health Promotion and Chronic Disease. Jessica, welcome.
Thank you, Secretary Bowling.
Glad to have you here. I know we're going to talk a little bit about exercise. I think in the winter we all think about hibernating, you know. How do we get out there and still get the exercise we need during those winter months? Any suggestions?
Oh, we have lots. So first of all, make it easy. Being able to walk is probably one of the easiest things you can do. So make it easy, make it fun. If you are on a work site, then things you can do when you're at your work site could be taking walk breaks, encouraging walk and talk meetings. You can attain a standing desk perhaps. While you're on the phone, stand up and kick around a little bit. Rather than emailing people, then you can maybe walk over to where they're at and deliver your message in person. If you're a community leader, you can be looking at things going on in your community, get involved with walking groups, seek out maybe a trail club that might be going on. Don't be afraid to get outside, just bundle up best that you can, play in the snow, bring your family. Check out your malls where you're at. Many of them open their doors to walking before hours or even after hours. It's a nice, secure place. They're well lit. You've got parking. You can grab a drink. You can get to the bathroom easy. Many suggestions like that. Even influence your family. We've got lots of traditions going on around in the wintertime, so rather than always eating, think of an activity that you can incorporate within that as well. I know when our family gets together, the brother-in-laws all play a game of, basketball, whether rain, shine, snow, whatever. They like to get together and do that. So using the steps wherever you can is also another easy suggestion. Parking further away and walking a little bit further. There are many things you can do. Use your stairwells in your work site, in your house.
Lots of great ideas, and that says to us, well, we should be hibernating, we need to be out there. I know my family likes to play charades, and so there's a lot of activity going on with playing charades. So I think those are great suggestions and people should pay attention to. I know that we have a couple of initiatives that go on through public health. Try This.
Yes.
Tell us a little bit about that.
Well, Try This is an initiative to knock West Virginia off all the worst health list. So many partners have come together. It follows up on a series of The Shape We're In, which was some stories about our health status, as well as all the good things going on in West Virginia about communities and leaders that have come together to address those particular health issues, namely obesity, diabetes. And so what we've done is put together a website. It's a beautiful website where you can find all kinds of things if you're a community leader wanting to start something in your community, whether it's community gardens, incorporating walking programs. What's nice about this is it showcases some really great leaders in West Virginia doing some really wonderful things in their community. There's lots of resources on that website, lots of evidence, lots of tools that all show that these are all evidence-based and proven strategies. Now, part of the Try This initiative also incorporates an annual conference. And that takes place every first weekend in June at West Virginia Wesleyan. We're getting ready to implement our third conference. And again, that brings together many people from across West Virginia, again, showcasing and talking about the great things they're doing. And then it allows communities to connect with other communities that are doing just what they want to do as well. Most of these efforts are at low cost, don't really take much, but a lot of passion is captured, a lot of energy is captured, and it's a really nice initiative.
I think it's really exciting because I think that, all the things that you're talking about really are things that we have to focus on in West Virginia. If we're going to reduce obesity, deal with diabetes, we have to really get out there and exercise, and we have to feel confident that there are things that we can do as a community, because every community is different. But when we share ideas, that really does make a difference. And I know that right now there are things that are called shared use agreements.
Yes.
And I think that's really important to share with the viewers, because I think sometimes people think there's no place for me to go.
Right.
And I think this can offer some options. Can you explain that just a little bit?
A shared use agreement or a joint use agreement is really an agreement with your school system. They allow folks to maybe come into their schools, use their grounds, their gyms, their courts during off-school hours. So a lot of communities are taking advantage of that so that they can put their sports programs within those schools. And there's a school in every community just about. So it's a really easy place for folks in the community to get involved, get together right there. And if your school does not have a joint use agreement, then start talking with some of the officials about how that could happen.
Yeah, I like the idea of partnerships. I do think, when we talk about, even children and obesity and some of the challenges we face there, I think the more we can encourage the school system, community partners, us at DHHR to all be involved, I think it can and will continue to make a difference. Now, I know some people have asked me, as a healthcare provider, well, how much exercise do I need? What do you recommend? What do you think is appropriate, and what do most folks talk about in terms of how much exercise do I really need?
Okay. Well, the Centers for Disease Control and Prevention, they recommend 30 minutes a day, at least 5 days a week of moderate activity, as well as strength training exercises at least 2 times a week as well. So that's sort of the minimum that will get you the health benefits enough that decreases your risk of diseases.
Now, I think that some people really, that can be a little bit scary, because they think, how am I going to get that 30 minutes a day, and what kind of things that can I do? And I think you've talked a little bit about that. And I think sometimes people like to be involved more in group activities rather than doing it solo. But I've had people say to me, well, how do I know is it 30 minutes all at the same time? Can I do 15 minutes in the morning, 15 minutes in the evening? What does the CDC say about that?
The great thing is you don't have to do it all at once. You can break it down in increments throughout the day. If you want to do it all at once, you can do it all at once. But that's really the neat thing about it, is you really need to move more and sit less. So any amount of activity that you're doing is always going to have a health benefit.
Oh, I think that's important for everyone to know, that it's not just I have to go out and go to a place to exercise on a bike or something, that I can really do it in my own home. I can walk around my house. I can go up and down steps at work. There are just lots of things that we can do that can and will make a difference. I know that when it comes to West Virginians being physically active, we have some challenges. How do you think that we, as a state, can get the message out? What more can we do to let people know the importance of physical activity?
I think we have many arenas where we can promote most policies and allowing folks, to really be active, whether it's during the day or at school or et cetera. So actually, that's part of creating that social norm of change, is the acceptance of doing it in all of these venues.
And I think that's a great point. I think accepting the importance of it and all of us being on board. Thank you, Jessica. We really appreciate having you here on our show.
Thank you. You're welcome.
Coming up, we'll show you how another DHHR partnership is helping kids in West Virginia get moving. Plus, Chef April Hamilton cooks up some fast and healthy meals to keep you warm in the winter. Stay with us.